serious medical professionals of Reddit, what are some interesting little-known facts about how the human body operates that most of us are not aware of? Story 1. Nerves are composed of fibers. Each fiber is a single cell that runs from your spinal cord to its destination. It's one long tube, not a series of connections. That means you have cells that are 3 feet long running to your toes. Story 2. Med student here. Less of a body fact, more or less a fact about us. We're not entirely sure how anesthetic knocks you out and stops you feeling pain. We're not even sure how it works in the first place. All that we know is that it works. Story 3. When you twist your forearm, your muscles are pulling on 2 parallel bones, so they cross. Kind of cool to think about. Breast milk actually changes its composition depending on the individual nutritional needs of the child drinking it. If a pregnant woman's heart tissue is damaged, her fetus will send stem cells to repair it. Psychotic masking is the process of your brain freezing an image if your eyes move over it too quickly. This prevents humans from getting the equivalent of motion blur. Story 4. We have a devoted section of our immune system called the innate immune system that is active 247. This includes your skin, mucus, and one of my favorites, macrophages, which literally eat invaders, chop their bits up, and display them on the macrophage's outer surface for other immune cells, T cells, to see. I think of them as bite-sized, helpful Vlad the Impalers. Story 5. Did you know you can slow your heart rate way down by taking a huge dump? Well, you can. Your autonomic nervous system is controlled by your vagus nerve. You know it as fight or flight. It's like the gas and the brakes. Well, you can stimulate the brakes when you get suddenly frightened, jump in cold water. Even having a full belly can stimulate it, which explains why you get tired after a huge meal, but it also gets stimulated when you bear down, like when you're struggling to. That's why if you have a bad ticker, it's possible to die on the crapper. We find a lot of people dead on the toilet, a lot. Story 6. Your blood has an incredibly small range of acceptable pH, 7.35 to 7.45. I've had a lot of people ask me if they need to eat different, take supplements, etc., because they've heard that they might be too acidic or alkaline. I need to explain to them that it's mostly marketing for various supplements that makes them think this, and that your body is very good at making sure your acid-base homeostasis is maintained. Edit a word. Story 7. Sleep tech here. I always thought it was cool that once you enter REM, your brain sends a signal to your spinal cord to paralyze you, which is why if a person is disturbed in the middle of REM, they can experience sleep paralysis. Their mind is awake, but the body hasn't gotten the signal that their sleep cycle ended, so they're not able to move. Story 8. The average person can only use about 10 to 20 of their actual muscle strength. With training, you can bring it up to over 30. Adrenaline can make it go up to 100, or at least very close. Story 9. Super extreme and dark. But if you're ever in a situation where someone has a knife at your throat, put your head all the way back, your right and left carotid arteries, which are the main sources of blood supply to your brain, and the vertebral arteries will move to the side so that you will likely survive if your throat is cut. Story 10. Med student chiming in. A majority of drugs only work because we have pre-existing receptors that bind to similar molecules that our body normally uses. For example, our body only reacts to opioids because we have endogenous opioid receptors to begin with. It's just that usually these drugs bind to our normal receptors super hard or for a longer time. Story 11. We can resuscitate 22-week gestation babies. This seems to blow so many people away when I tell them this. That's barely halfway through a pregnancy. Most people don't even learn the gender until 20 weeks. They rarely have good outcomes, and they almost always have complications. But it can be done. Story 12. One of the muscles that controls your eyeball, the superior oblique, loops around a structure called the trochlea to form a pulley system. It's very basic anatomy, but IMO, it's both amazing and weird to look at. Story 13. Your muscles are so strong that if all of your muscles in a region were to fire at once, they could snap your bones and rip tendons for muscle. Your body has a process in place to prevent this, called reciprocal inhibition, the Golgi tendon reflex. Essentially, it forces some muscles to relax when others fire. However, under stress, this inhibition can be deactivated. So when you hear stories about tiny little women lifting cars after their kids get trapped under them, yes, that's possible. Story 14. Nurse here. I work in the cath lab, which is where people go to have angiograms, x-rays of the arteries of the heart to check for blockages, and sometimes get stents if they do. One of the most incredible things I find about the human body is that sometimes when people develop blockages over a period of time, their body develops what we call collaterals. They grow their own natural bypasses in the heart around the blockage. It's so cool that the body can do that. Story 15. That max heart rate during exercise is a function of cellular biology. Unless you have other cardiac abnormalities, Your ventricles, the pumping chambers that create a pulse, can't accept impulses beyond a certain range, no matter how hard you work out. The connection between the atria, collecting chambers, and ventricles is primarily regulated by calcium moving across the cell membrane, not the sodium-potassium pump. So unless you have a congenital defect of conduction, or your ventricles are firing independently, which can soon become fatal, that max heart rate is pretty consistent. It's also true that the atrial rate is similarly limited. Story 16. I'm not entirely a professional, but I worked as an EMT firefighter for a while. Every single cardiac arrest we went to was found on the toilet. Having a heart attack feels like you have to, so they go sit on the toilet, and the force of them pushing actually helps in stopping their heart. I told my boss this, and now he is scared to take A. Story 17. Med student here. Always thought that teratomas were very interesting. Although I'm generally not too sure how little known they are, essentially it's possible that females can grow things like hair, muscle, teeth, and bone in a little pouch. But hey, race the thing. The pouch is located right on the ovary, growing teeth in the ovaries. Always thought it was a bit weird. You can even grow things like thyroid tissue or skin cancer inside of the teratoma. Anyway, that usually get removed without too much issue, but they're kind of gross. You can Google it if you're curious to see pictures. Story 18. I have a couple, going to put them in layman's terms as best I can. Your pupils will constrict or dilate, not only in bright or dim lighting, but also when looking at objects close and far away. This is known as accommodation. Your pupils will constrict or dilate together, even if one eye is in dim lighting and the other is in bright lighting. That is, if one eye is exposed to bright light, both eyes will constrict in response, even though one eye is not exposed to said bright light. You can test this out by shining a torch on someone's eye, but shielding the other eye from the torch. You'll notice that both eyes will constrict. This is known as the consensual light reflex. It's one of the tests we do in the cranial nerve examination. This image demonstrates it well. It requires energy to relax a contracted skeletal muscle. No energy is needed to maintain contraction. This is the basis of rigor mortis. Edit change some parts for clarification bonus. You can change your heart rate through your breathing. This is known as respiratory sinus arrhythmia, RSA. It's expiration breathing out that slows down your heart, while inspiration breathing in increases your heart rate. So taking deep, prolonged breaths out can calm you down. Most of your grip strength comes from your thumb and pinky. Try grasping something without your pinky. It's significantly weaker without it. This study shows that your pinky accounts for 33% of your grip strength. Story 19. Nobody really knows how cholesterol leaves the body. We make a lot of it and turn a fair amount of it into bile, but almost a bile salt are reabsorbed in the gut. So that can't be it. There are no known catabolism pathways to turn cholesterol into energy. So where does it all go? Story 20. Respiratory therapist student. If you have surgery or sick, the best thing you can do to keep your lungs open when you're confined to a bed is coughing. The pressure will help open any areas that may have collapsed. Story 21. It is possible to be born with a heart that faces the wrong way, meaning it faces to the right instead of the left. The condition is called dextrocardia. Story 22. Medical assistant here. Our brains are crazy and not really well understood. People with severe anxiety can give themselves seizures of the shaking and foaming at the mouth kind. Traditional anti-epileptic medications do not help these kind of seizures. The standard treatment is cognitive behavioral therapy, CBT. Story 23. Your body is really good at hiding tumors. Or rather, tumors are just really great at hiding themselves. This is mainly in part due to tumors just being a clumped mess of your own cells, unfortunate accidents that are now destined to multiply for eternity until they devour their own host from within. What many of us don't realize is that most of the time, cancer is not detected easily on its own. Sure, there will be some people who may start noticing an abnormal lump in their neck and go to get it checked. But for every one person where cancer easily presents itself, there are 9 where it is found incidentally via other means. A lady might not even know she has cancer until she gets out of bed one day and suddenly fractures her femur. When she goes to get it checked, she's told that she has metastatic ovarian cancer, which had spread to her bones and weakened them. Some cancers can hide for a very long time. This woman may not have gotten her cancer diagnosed because her symptoms probably just would have been some nausea or fatigue. Despite that, for certain disease sites, i.e. prostate and breast, there is regular screening which can help detect the cancer early on. But there will always be that one person whose life is literally destroyed overnight because the cancer spread to their spine and core compression left them permanently paralyzed. Cancer truly is an enigma. Story 24. MD here. The amygdala, located in the brain, is responsible of us for getting pain. That is how we fall in love again and women get pregnant again after giving birth. This is for us not to be tormented forever by difficult times like the death of a loved one. So we can remember the sad times, but not vividly. So, thank you, amygdala. Story 25 nursing student. I've just learned this year, even after working on hospital floors for years. We can infuse medication through your bones. It's called intraosseous infusion. They drill a hole into your bone, typically the tibia, with a special drill and bit. Then they use saline to move the marrow out of the way and create a pocket they can infuse medications into. Apparently, the drilling bit doesn't hurt too bad. The injecting of saline and the infusion of medication apparently hurts like a though. It's usually done in emergency situations when the patient is going to die and they can't get for access. I feel like a lot of people outside of healthcare don't know this. I also think a lot of people in healthcare might not know this. Story 26, that in order to build a good immune system and be healthy for your lifetime, you need to get sick, you got to play in the dirt, scrap and bruise yourself, eat undercooked food, get colds, flus, and stomach bugs, touch germy things, eat stuff off the floor, etc. Literally every germ you come into contact with, your body fights and it learns. It makes instructions for how to fight pathogens in the future. Our overly sanitary society is killing us. In less developed nations, they can drink the water and eat the food because they've developed immune systems to fight the pathogens. It's not that their water is stronger than first world nations. It's that our bodies are too weak because we're constantly cleaning ourselves, whipping germs away from things we touch, and avoiding illness. As a medic, I was sick quite a few times in my first years of work. Now, I rarely, if ever, get sick. I've come in contact with so many different germs that my body knows how to adequately defend itself. If you want to live longer and healthier, get sick while you can when you're young. Forget all that kills 99.9% of germs because it's rendering your body's immune system useless. Our bodies are meant to adapt to change. Literally, every stress on our body causes it to adapt and strengthen. Jarring movements strengthen your bones. Exhausting cardiovascular work strengthens your heart and increases lung efficiency. Lifting heavy weight makes your muscles stronger, and getting sick makes your immune system stronger. Honestly, I wish people knew this. It would greatly decrease the strain on public health systems. The media is fooling you by scaring you into thinking every germ is a death sentence. It's the complete opposite. So please, allow yourself to get sick and let your body, that's been evolving for 200 to 300,000 years, do its job. Story 27 RN PhD here. I love that the human liver can regenerate itself if healthy. So if you donate a part of your healthy liver to your sick kid, both of you will eventually end up with a whole liver. This is THSNKS to our amphibian and fish prior lives. Thanks, evolution. Story 28, touch your thumb to the tip of your index finger. The most prominent tendon most people see running down the midline of their wrist is the tendon of the palmaris longus muscle, and some 20 people are born without one. Story 29, women go into menopause because they run out of potential eggs. Don't mean with that you can't run out. There's billions you run out, and that's when you go into menopause. And by the way, there's not billions. Average female newborn will have 300K, 2 mil. Half of that is gone by the time puberty hits. Gonadotropin-independent folliculogenesis. Story 30, endoscopy nurse here. Before a procedure, patients are refrained from having solid foods and no dairy in their tea coffee. The reason is because fats take a longer time to be processed by the body, needing to wait at least 6 to 8 hours if ingested to do a procedure than other foods. Might also be why people who are in a keto do not feel hungry for most of the day. Also, it's evident to us when a patient has eaten fatty foods a day before gastroscopy, because the villi of the duodenum looks like it's coated with white paint. Story 31, occupational therapist here. The human body is not symmetrical at all. If you look at my black naked, you'll see that my left pelvic bone is straight and my right pelvic bone protrudes a bit. Been to a couple doctors, done x-rays, everything, nothing wrong there. Some people have a heart that's more to the left, others have it more centralized, etc., etc. Story 32, pediatric neurotrauma, ICURN here. Sometimes, when people have swelling on their brain, a portion of the skull will be removed and placed in a subcutaneous pocket in the abdomen until it can be replaced weeks, months later, once the swelling has gone back down. Story 33, it's not uncommon for people to have extra small bones in their feet or hands. My mother recently twisted her ankle, and the x-ray revealed a small bit of bone. One of the doctors thought at first she had broken a bone, but it turned out the bone was there the whole time. Story 34, when people talk about having a sugar crash, it's not because you exerted your energy doing a certain task. Insulin is what breaks down the sugar in your body. A side effect of insulin is sleepiness, drowsiness. When you have a big meal that has sugar or carbs, and you feel like you're going into a food coma, it's your insulin. Story 35. If your blood is Rh negative, but you have the possibility to carry a baby with a positive blood type, you have to get a special shot just in case the fetus bleeds, because otherwise your body would basically attack the fetus as a dangerous foreign object. Story 36. Biomedical Sciences undergraduate. But because the human body only needs one functional X chromosome, otherwise men wouldn't work, during embryonic development of female embryos, one of the X chromosomes each cell is turned off at random and shrivels up into a thing called a Barr body. It's called lionization or X inactivation, and it's the reason tortoiseshell calico cats have their coats. In the orange bits, the gene for black fur was turned off, so orange fur is expressed, and it's the reverse in areas with black fur. Story 37. There is not enough pressure produced from a pumping heart to bring the blood back to the heart once it has passed blood to tissues that need it. Your veins, the vessels that carry unoxygenated blood back to the heart, is filled with valves. You actually use your muscles to squeeze the blood up movement by movement. The valves ensure the blood doesn't go back down as you move. Also, not completely human body, but an MRI imager actually uses magnets to align all of the hydrogen atoms in your body, mostly from water and fat, and from there uses fancy physics to get the image back. The magnet used in the clinic typically has 3 times higher magnetic force than a magnet that picks up cars at the salvage yard. Story 38. Men have a patent inguinal canal. If you take your index finger and press up on the ipsilateral testicle, you can use the flexibility of that skin to find a hidden compartment in your own body. Aim up, and then hook your finger toward your pelvis at approximate a 30-degree angle. You have an empty recession on both sides of your body. It's pretty neat. If you have a female significant other, they'll be mega jealous of your secret pouch. Story 39. Our immune system has these suicidal, known as neutrophils. These neutrophils are typically the first cell that is activated when there's an infection or some issue, and they don't care what they attack. When they see something to fight, what they do is release chemicals, chemokines, and cytokines, which cause even more of themselves to come and fight whatever off, along activating other immune cells. If the pathogen, let's say bacteria, is covered with antibodies, the neutrophil just eats them, and lets acid inside the neutrophil burn the bacteria away. If they're not covered in antibodies, the neutrophil release granules of acid, proteins which burn holes in the cells. Not just bacteria, these chemical and proteins also injure our own cells. Once all the chemicals are spent, the neutrophil then kills itself, but splurts out its DNA with proteins attached, which forms a sort of web. This web traps bacteria, prevents them from moving, and kill them. They're the reason why we have pus. Pus is actually mostly dead neutrophils after they've suicided themselves to kill everything they see. Story 40. I work in X-ray, and we have a lot of black humor jokes in our department about rectal foreign bodies. When someone tries to use an improvised toy anally, there is a process known as retroperistalsis. This is a reversal of the normal direction of colonic motility that effectively draws items in the anus further up into the rectum and back up the colon. I think if most people were aware of the possibility of this happening, it probably would do nothing to prevent their eagerness to experiment, but it is still the source of black humor for those in my profession. Story 41. We have immune cells who police our other cells and require them to place some of their internal products on their surface, basically the equivalent of a police officer asking for your ID. If the cell has been hijacked by a virus, that cell will put the viral products on its surface and will be caught red-handed. MHC is awesome. Story 42. The drive to breathe doesn't mainly come from a lack of oxygen, but rather from a buildup of CO2. But still, it's not exactly the CO2. It's actually the acidosis hydrogen ions created by the CO2, which decreases the pH of the cerebral spinal fluid, irritating a part of the brain called the medulla, which drives the body to breathe. Interesting process, breathing. Story 43. Medical student here. Cremasteric reflex is something only guys have. When your inner thigh is stimulated, the muscles in you will contract, pulling your testicles towards your body instinctively. This is to protect those family jewels from being injured. This also happens in cold weather to keep your brovaries warm. Story 44. You could literally die of a broken heart, and that you actually have heartstrings. Thought for the longest time that the idea of heartstrings was just another saying until I took A and P. Story 45. Failed vet student here. 80 of the immune system comes from the M cells in the gut. Also, people don't seem to realize the intestines don't just let anything diffuse into the blood. There are specific channels, and gastric juices are specialized to ensure food is broken down into specific pieces that fit into the channels. The moral of the story: glucose isn't poison. In fact, glucose is 100 absolutely required for cellular respiration. Story 46. Unless you have a documented food allergy or intolerance, it doesn't matter what you eat to gain weight. If you want to lose weight, eat less than you burn and vice versa for gaining. Story 47. Attention. Serious tag notice jokes, puns, and off-topic comments are not permitted in any comment, parent or child. Parent comments that aren't from the target group will be removed, along with their child replies. Report comments that violate these rules. Posts that have few relevant answers within the first hour and posts that are not appropriate for the serious tag will be removed. Consider doing an AMA request instead. Thanks for your cooperation and enjoy the discussion. I'm a bot, and this action was performed automatically. Please contact the moderators of this subreddit message compose or AskReddit if you have any questions or concerns. Story 48. As far as I know, only a med student. There's only one nerve in your body that you can see from the outside of your body without getting invasive. It's called the chordae tympani, and it's a branch of your facial nerve that you can see through most eardrums if you have good lighting. Oddly enough, it travels through your middle ear, but it eventually meets up with your tongue to let you taste. Story 49. The brain feels like a pulsatile, soft, warm jello. It's amazingly jiggly, and though it has inertial resistance, disturbingly soft. We're helmets, folks. Story 50. TLDR. Our complex nervous system, developed from simple intestinal nerves, what you think of for the nervous system, brain, spinal cord, motor neurons, etc., is actually a specialization of cells from our GI system. Yeah, our glorious brains are just an evolution of using stimulation to move through a tube. Nearly every neurotransmitter found in a nervous system proper is used by the intrinsic nerves of our gut tubes, the enteric nervous system. There are even cells, interstitial cells of Cajal, that keep the rhythm of contractions within our intestines that are thought to be the ancestors of the cells that keep our heart rhythm, sinoatrial node. Story 51 from a med student in GI term. The separation of urine and feces is a relatively recent evolutionary development. Birds, reptiles, and some other animals still have a combined receptacle for their and poo called a cloaca, named after Roman sewers. Us mammals have a urogenital septum that descends during embryological development to separate the GI tract poo from what will become the urethra pee. For some unfortunate few, this doesn't happen as planned and can be born with anorectal malformations. They'll let you all use your imagination for that. Story 52. We don't really have pain receptors in the limbs that send signals to the brain. The brain gathers a lot of information, and if it perceives damage or danger, it will send out pain signals to stop you doing something, so you can feel pain without anything actually being damaged in your body. Story 53. 1. You have blind spots in your vision that you normally don't notice. That's because your brain picks up on stuff around the blind spots and previous visual information to synthesize an image. 2. There are actually multiple ways that our brain sees through the eyes. If possible for some blind people, there are many different causes of blindness to be aware of objects around them, without any form of stimulation other than visual. Some blind people's brains also can tell when it's light or dark out, and their circadian rhythms sync up. 3. It's near impossible. Keep your eyes entirely still. You will naturally slightly move them almost all the time. You may think you can, but probably aren't, for your body is able to make neural decisions end into the brain via interneurons. The most commonly known is that test gen that don't has you sit down and hits your knee. That stretched nerve they stimulate connects to the spinal cord, but then connects right back down to your leg. This is in addition to it going to your brain, but that takes longer. I could probably go on for an hour about the nervous system. I'll add another one. It is entirely possible for someone with XY chromosomes to look and develop all female characteristics due to a variety of causes. Story 54. Many people think that the stomach acid is part of the digestive system. And yes, it is, but it is also part of the immune system. A lot of things can be broken down by other chemicals like the enzymes amylase or protease. The acid is mostly there is a straight-up assault on anything that wanders in the front door. Many things can survive a certain level of acidity, but to be immersed in an acid bath is a pretty good initial security system. Story 55. There are more chemical reactions occurring in your cells at any 1 second that they can't even be calculated with any bit of accuracy, something around 110-20 Riksensek or higher. Story 56. Your alimentary canal gastrointestinal tract is considered to be outside of your body, as there is an opening on each end to the outside world. Therefore, food isn't inside your body until it is absorbed. This also means that your stomach and pancreas can function as exocrine glands. Story 57. The ratio of bacterial cells to human cells is about 1:31 in the entire body. This means that there are more bacteria in your body than there is you. Story 58. When you think about moving a certain part of your body, a specific part of the brain associated with the part you're thinking of activates, whether you move it or not. Story 59. ADP synthase, the enzyme that produces most of your body's ADP. Basically, energy is a motor. It actually uses mechanical energy to convert ADP into ADP. When you lose weight, the mass is actually lost as carbon dioxide in your breath. You literally breathe out what was once fat tissue. Your body actually produces a small amount of water. This sounds super weird, but water is one of the products of cellular respiration. So it must be true, it's just not that much. Story 60. There are more bacteria in and on your body right now than there have ever been human beings. In fact, one of the most important organelles within the cell, the mitochondria, are thought to have once been bacteria-like single-celled organisms that were taken into a eukaryotic cell. A large number of bacteria reside in the gut, particularly the colon. They consist of an assortment of different species living in their own complex ecosystem called the microbiome. A baby is not born with a microbiome, but develops one soon after birth. There is a lot of scientific research going into the microbiome and how it affects not only gut health, but weight, mental health, cardiovascular risk, even cancer risk, among other things. There are some foods that can influence the microbiome. These are foods that have active cultures within them. This basically means that there are microscopic organisms present in the food. Two of the most common include yogurt and kefir. It is often recommended to eat these when taking antibiotics. The reason is that antibiotics can kill gut bacteria indiscriminately, sparing more resistant bacteria that can multiply and cause problems. Some people take pills and supplements with supposedly healthy bacteria in hopes of rebalancing the microbiome of their gut in favor of more benign bacteria. These are called probiotics. There are many publications coming out about this. These are thought to be protective from certain gut infections, or at the very least felt not to be harmful. Despite this sentiment, we really don't know or understand the complete role that the gut microbiome has in human health. TLDR, there's tons of bacteria in the human body, including the gut, and they seem to be doing more than hanging out and causing gas. Their other roles are a subject of vigorous research. Story 61. Gate theory of pain. Pain is felt through spinal cord, and then signals reach the brain. Think of the doggy gate in the main door. Only one pup can pass at one time. Imagine if I slap you. You'll feel it, but immediately after, if a car runs you over and your bones break, you won't feel my slap anymore. Gate will only allow one to pass. Story 62. You can develop allergies anytime and also stop being allergic to something. You could also develop allergies in an allergies test. Another fun fact about immune system is that you're able to keep rejected organs functional up to months, years. Edit spelling. Story 63. The way our brains develop is first, we develop impulsive tendencies, want to do things, and then later, controlling tendencies develop on top of them to control our behavior. So the highest function of the brain is to control and curb the over-enthusiastic part to ensure that we are not impulsive when we don't have to. That's why young kids are naughty and learn behavioral control as we grow up. That's why alcohol makes people do brave, stupid stuff. In small doses, the first effect is that it calms down the center, which has the inhibitory controls, and that's what makes us let go of our inhibitions. Think how many times you wanted to drink before doing something adventurous. Further alcohol concentration makes you go from maybe try something new to hold my beer and watch me do this. Further alcohol just paralyzes your impulsive or enthusiastic part, and that's when you're drunk and falling over. Further, it kills, either due to acute alcohol intoxication or later on severe DTS. Story 64. Female babies are born with all the eggs they will ever have. So technically, my mother carried me in her uterus, but also kind of carried what would become my daughter as well. Story 65. Anxiety meds work in a really weird way. They act directly in the mesolimbic pathway, which is known as the reward pathway. Lots of dopamine in there. So it means pleasure, motivation, and reward stimuli. Makes you feel good. There's an inhibitory neurotransmitter called GABA that in this pathway is in charge of inhibiting the production of dopamine. Basically, what anxiety medications do is that they inhibit GABA, the inhibiting neurotransmitter, which means that dopamine is neither being produced in more or less quantity. It's just a normal amount that is not being inhibited by anything else. It's trippy how these things work. Story 66. I waited not much longer than a week. I severed all of the median nerve and 95 of the ulnar, and the tendons were pretty much severed completely. I had an excellent hand and wrist surgeon with Penn State Hershey. They were waiting for the swelling to go down, but also the nerves and other tendons were starting to retract up the arm. They would have liked to have waited longer, but they couldn't. OMG, when that nerve block wore off. I thought I felt pain before. That was nothing compared to what I was experiencing then. And I experienced childbirth 3 times, most of them with no or minimal pain relief, and this nerve pain still blew that out of the water. There was nothing that relieved it. They couldn't give me anything at first because they needed for me to experience this pain so I can report what was happening, and there was a possibility that I would not be able to use or have feeling in my right hand. So, after doing a ridiculous amount of writing, nothing, and physical and occupational therapy, I now have full motility, limited sensations, and sometimes no feeling whatsoever, but sometimes it's a good thing also. The nerve issues are not as intense as what they were 10 to 12 years ago, but they're definitely still there, and I do not forget about them. Sorry this was so lengthy. Trying to give an accurate response of my experience. Story 67, you can literally save yourself from a dangerous heart rhythm called supraventricular tachycardia, or SVT, by taking a slash bearing down like you're taking a. Story 68, the kidneys produce a hormone, erythropoietin, that tells the bone marrow to produce red blood cells. When people have kidney failure, they stop producing this hormone and therefore don't make red blood cells. Since red blood cells only live about 120 days, patients with kidney failure would be dead in 120 days. Therefore, dialysis patients get erythropoietin with every treatment so that their bodies will make red blood cells. Story 69, an estimated 10 to 35% of the population has a photic sneeze reflex. Sunlight is a trigger, but artificial illumination from light bulbs and camera flashes can also cause sneezes. Story 70, mom of breastfed twins here. When one of my babies was sick, I asked the DR if I should keep baby on A and baby B on B, so they don't get cross-contaminated, but DR said nope. If baby is sick, then baby, it will get extra antibodies no matter what you fed from. Mind blown. Story 71, pharmacist here. One thing I find myself explaining to a lot of people is that you shouldn't mix acetaminophen paracetamol with alcohol. The alcohol interferes with the breakdown of the drug and actually causes a toxic metabolite to form that will damage the liver. A lot of people take it for hangover headaches, but there's still usually alcohol in your system at that time. Story 72, adipose tissue is not just a dormant way the body stores energy. It also functions as an endocrine organ, releasing hormones that affect bodily functions and can significantly negatively impact cardiac function. This is one of many reasons why being obese carries a higher mortality risk, no matter how healthy or active the person believes they are. Story 73, hyperventilating decreases your blood CO2. An increase in CO2 is what makes you need to breathe again after holding your breath. So if you hyperventilate, therefore increasing your oxygen intake and decreasing your CO2, you can hold your breath longer. It comes with responsibility, though, because your body won't give the signal of needing breath, so it can actually be really dangerous. A while back in my school, there was a competitive swimmer that used this tactic, and it was well known that he could stay under the water for a long time. But because his brain didn't signal to him that he needed oxygen, he ended up losing consciousness under the water, and he drowned. Also, I honestly don't know why this happens, but if you can't touch your toes, spin around a few times and try again. I guarantee you'll be closer to your toes the second time around. I've been showing people that for 6 years, and it blows everyone's mind, LMAO. Story 74, the left testicle hangs lower than the right. It's an evolutionary trait to let them slide past each other when you walk, instead of getting crushed. The cool thing is how this is accomplished. Each testicle has an independent vein and artery feeding it. The right gonadal vein is connected to the inferior vena cava, very big vein, and the left gonadal vein is connected to the renal vein, relatively small. This results in a slightly higher blood pressure in the left testicle, making it slightly heavier and more likely to hang lower. Remember, arteries take blood from the heart, and veins take blood to the heart's secondary. Fun fact, this arrangement of veins is identical in males and females. Story 75, I work for a private practice physical therapy group. One of the services we offer is physic therapy for the pelvic floor for men and women. It's incredible how many debilitating issues can be drastically reduced and treated by seeing a therapist once a week.